Neurodevelopmental assessments. Sub-skill, moral reflex, test and judgment criteria. Holding the child's head and shoulders, the examiner suddenly lets the head and shoulders drop back a few inches while releasing the arms. Or the examiner stimulates the child with loud noise while the child is lying on one's back. Pass. The normal response is that the child's arms should fully abduct and extend, then return towards the midline with the hand open and the thumb and the index finger forming a C shape. The child may cry for a minute. This reflex normally disappears after 2 or 3 months. Sub-skill, muscle tone, test and judgment criteria, muscle tone assessment. Observe muscle function, lift limbs up and leave them down on the floor. The child will move all limbs to midline. Passive movement by moving each joint in their range of motion to feel and assess resistance. Muscle length and range of movement while moving. Hold the distal part of the limbs and shake gently to feel how the joints move and their flexibility. Pass. Normal muscle tone, not hypotonia or flexit. Sub-skill, ankle clonus. The examiner holds the child's calf by 4 fingers and lifts the leg from the floor. Then the examiner uses a thumb to put on the child's foot up and down 2 to 3 times and quickly press up the foot 1 more time and observe for rhythmic clonic movements. Pass. The child has rhythmic clonic movements around 1 to 4 times or has no movement of the foot. For the child having rhythmic clonic movements more than 5 times is abnormal result. Sub-skill, asymmetry, tonic neck reflex, test and judgment criteria. The examiner positions the child lying on his or her back and turn his or her head to one side. Then the limbs on that side straighten, the limbs on the other side bend or flex. Pass. The child straightens the limbs on the side that the head turns to. When testing it, should not be found this response every time. Remark: if this response is found every time, take the child to see a doctor. Sub-skill, integrated palmar grasp reflex, test and judgment criteria. The examiner places in the child's hand and strokes their palm on the little finger side. The child's fingers will close and they will grasp it with a palmar grasp for a moment and then release. If the grip is very strong, it may be able to support the child's weight. It is abnormal response. Pass. The child's fingers will close and they will grasp it with a palmar grasp for a moment and then release by oneself. Sub-skill, parachute reflex, test and judgment criteria. The examiner holds the child's waist and lifts away from the floor about 1 foot and then hold the child down suddenly to face forward as in falling. The child will extend both arms forward quickly and equally. Pass. The child will extend both arms forward as if to break a fall or parachute landing posture.